Dear friends, I am happy to meet you once again Saturday. Today is 2nd December 2023. We have successfully finished 1288 cases of Puberphonia. This patient is from Pune. So every day we are excited by seeing different type of people and helping them. This is not only changing the voice, it is a changing the life of the Puberphonia boys. A great thing. Now, more speech therapists are interested in knowing about the treatment of Puberphonia. So, one speech therapist had asked me, why not you teach me? Yes, I am interested in teaching you. I have talked to her for half an hour. Then only she has understand the importance of Puberphonia. It is not merely not merely knowing about Puberphonia. But there are a lot of important things in Puberphonia because our research is completely changed from the concept what now they are following in all over the world. My concept of Puberphonia is different. That is what all should be able to understand first. And what I think it should be known to the world, that is what I am thinking. First, what is the cause of Puberphonia? I have already told you the people are more interested and telling that the problem is in the vocal cord. My view is vocal cord is normal. Why you are blaming the vocal cord? They operate on the vocal cord. Even though the vocal cord is normal, they operate in the larynx, even though the larynx is normal. This is only my suggestion. See, science is subject to change. But in the textbooks and everything we say, larynx is normal. Then why you treat the larynx? It is not necessary at all. It is an unwanted thing we are doing. That is, we have to understand. When everything is normal, you are still want to treat it. This is what happening. The important thing is we are telling the cord in the is normal. It is only the breaking of the voice has not happened for boys in adulthood. They feel it is very simple. Oh, what is the breaking of the Puberphonia voice? Supravocal tract. So don't feel from child, it is not increase just like a miniature, it had become bigger. No. As growth begin, process take place, changes in the hard and soft tissue that makes a significant change in the vocal tract, including the sinuses. That is very important factor. Sinuses, no and back of the throat grow bigger, thus create more space within the head to allow the voice to resonate. The cavity, oral cavity become bigger, pharyngeal cavity will become bigger, nasal cavity will become bigger, sinus cavity will become bigger. So it resonates the voice. So that is what causes the break. Pitch drops, they change in vocal range. So this is what usually we hope is children, male and female, before the age of puberty, they try to talk with the vocal cord. They scream just like a bird. So that will be high pitch. Then in male, because of the enlargement of the mandible, maxilla, buccal cavity, a boy, a matured boy need not scream. He'll be calm, but he'll be strong. The cavity of the sinus, nose, and back of the throat become bigger, more space. More space means it allows to resonate, that's all. So child usually use their vocal cord to talk, but adult male, they used to talk with the back of the throat. That is low pitch. That is the change occur. That voice only the boys like, he will be calm, but says hello. It is coming from back of the throat. Deepen the voice, which attract the woman. And so it is the character of a maleness. So this is a reason. So it is just occur at the time when the penis, the male sexual organ develop with the rapid growth. But it is not clear why the change occur. In male and other species develop deep voice to attract the woman and intimate their sexual behavior. So this is what we propose. The cause of puberphonia is not breaking of the voice. Not breaking of the voice means you are having a laryngeal voice, vocal cord voice, which break into throat voice. Still lot of confusion about the chest voice and head voice. I never want to go into that confusion. Boys do more exercise. They want to prove they are strong. When the adulthood comes, 15 years, 16 years, they jump, they do more exercise. They breathe heavily and they relax the larynx and vocal cord. And then they start to speak from the throat. That is the important thing happen. What does the voice break? When it break? So when the muscle become tense, they do not move freely. So vocal cords don't move freely. This restrict the movement of the vocal cords. This can result in crack when they speak as the fold struggle to move as the wanted pitch, the volume changes. The inference what you are getting is change in laryngeal voice to the pharyngeal voice. I hope you are clear. There is a change from the laryngeal voice to pharyngeal voice. So that is the important thing happen in voice break. One of the speech therapists told me in thyroplasty surgery, type 3 thyroplasty surgery is done for puberphonia all over the world. This surgery was founded by Isuki in 1974. So he had clearly told before operation, you press the Adam's apple, it will relax the vocal cord and you will get normal voice, normal low pitch voice. Then only he start doing surgery. So relax it. Relax means vocal cords are not used to talk in puberphonia. That is the treatment. So immediately after the operation for puberphonia, vocal cords are relaxed by type 3 thyroplasty, TP3. So vocal cord are relaxed, but you will get low pitch voice. So when the vocal cords are relaxed, the action of the uvula is upper handed and you will get the normal voice. So this also gives as a inference in puberphonia larynx, especially the vocal cords are normal. Then where is the question of operation in the laryngeal framework or vocal cord? Number two, nowadays we are doing a lot of functional MRI of the vocal cord, where you will see vocal cord only vibrate, but uvula is a speech organ, so definitely it moves lot. So we feel, number three, uvular words should be included in the international phonetic alphabets. So along with that, number four, we feel the International Phonetic Association should consider uvular and glottal words. This is supported by the voice produced at the level of eustachian tube. That I have told you clearly. Eustachian tube also is just not a tube connect, merely tube connects the middle ear with the pharynx to maintain the level drainage, okay, but it also helps in resonating the voice. It gives direct message to the brain through the inner ear, through the cochlea. What we talk, we are able to hear through the eustachian tube. So the etiology of puberphonia is only non-breaking of the voice. So other etiology can be considered or it is idiopathic. Another important thing I am going to tell you is history taking. See, the standard history taking by doctors in Puberphonia, there is a certain law which is already given in the book. That is called, when you see a Puberphonia boy, you have to ask for GRVAS. That is a standard scale. Grade, this is the only one question you have to ask. You have to find out how is GRVAS scale. GRVA scale means, G means grade. What is the grade of the voice? There are 4 plus, grade 1, 2, 3, 4. That is the grade 1 or 2, grade 3 or 4. Second point is roughness. Roughness, grade 1, 2, 3, 4. Third is asthenia, weakness of the voice. So that is grade 1, 2, 3, 4. Or strain. How you strain and talk. These should be recorded. So 5 points only. Grade, roughness, breathlessness, asthenia, strain. Then you are grading how much it is there. This grading may be good for psychological problem in the speaking. Not at all in Puberphonia. This grade 1, roughness, breathless, asthenia, strain are not at all required for Puberphonia. The boys are coming. Why for treatment? Why they are coming for treatment? They are just coming at one. They talk in phone. They feel, the other party feel a lady is talking. A female type of voice is there. That also, if you ask, they won't reveal. Oh, voice is changed, voice is rough, low voice, it is not audible, they will change. Because once again, if you ask, you are bullying them, that's all. Are you able to understand? Bullying means you are insulting them. Or your voice is female voice, then it is directly insulting them. All this question of asking that your voice is very female, you should try to avoid it. But indirectly you can do it. Indirectly how? If a patient had come to you, he is having a female voice, oh, you are having female voice, you should not tell, then he will run away. You record his voice 5 times and find out the quality. Our computer says your voice is female type, we have to make it. Then he will be convinced and he will accept for treatment. Very simple thing. So asking another question, how long you are having? This is also bullying them. They won't enjoy that question because they want to hide the factor that it started only after phone call from friends that your voice is like a female, or they recognize something like that. When they talk, they see the body of the boy. So these are all the questions only go for bullying of the boy. So they will see when a boy comes, see why he is not consulting the local ENT doctor, because every question is bullying them. So they will try to avoid going to the school or college or workplace because they will simply say, are you having a lady character? So same thing happened with the doctor. Then what is the meaning of taking treatment? They won't allow. So if their life go on like that, they may turn into homosexual that can lead to a transgender association. Another important thing I want to inform, no medical book explain the correct thing about transgender. There is no chapter at all in medical book. Big medical books are there, basic medical books, psychology book, or jurisprudence, or ENT. No book is having a chapter regarding transgender. Why it is not explained? Even a medical person or paramedical person don't know whether the transgender person is having a male sex organ or not. Nobody knows. Only assumption is there. It is rudimentary, it is small, incapable. This is what they used to tell. So it is not like that at all. They are having a good male sex organ, but it was not used. That is what I want to suggest. So, more about the homosexual. When we talk about homosexual means, immediately the world will think against us. But this is a human nature. Medical books should explain about the completely about the homosexual or transgender. No medical book is having an explanation about the things. Means we have to slowly start and putting a chapter in basic medical science. So that is what I wish. I can explain little more thing in the next Saturday. Hope you have little understood what I am telling. So this is our, we have successfully finished 1,288 cases of Puberphonia today, Saturday, 2nd December 2023. I hope we will meet next Saturday. Thank you. Great. Hope to meet you.